Hello, and thank you all for being here. Welcome to this NPH USA St Damien Pediatric Hospital Fund tour of St Damien Hospital in honor of World Health Day. For those of you who may not know me, my name is Jennifer Reno. I lead the support efforts for St Damien Hospital at NPH USA, and I'm going to be your moderator today. We've all seen the recent news coming out of Haiti. People are experiencing rampant and non-discriminatory brutality amid other life-threatening conditions, such as food insecurity and cholera outbreaks. It is a heartbreaking humanitarian crisis. I begin by asking you to join me in a moment of silence for all of those in Haiti. Thank you. With us from St. Damien Hospital are Dr. Pascal Gassant, Executive Director, and Fadul Amasil, Director of Operations. We also welcome Drs. Jeff and Ellen Kemp with the St. Damien Collaborative. Both are board-certified pediatricians, married for almost 40 years, sharing a lifetime commitment to giving back to children around the world. The St. Damien Collaborative is a unique partnership. Members of the collaborative work together to improve pediatric health in Haiti through its support of St. Damien Hospital. The collaborative works to achieve this goal through the bidirectional exchange of personnel, information, and resources between St. Damien Hospital and U.S. health partners. We're going to begin by getting the perspective of Dr. Jeff Kemp. Throughout the presentation, we invite you to put any questions that you may have in the Q&A, and we'll do our best to address as many as we can at the end within the time frame of the program. Jeff, we so appreciate you and Ellen joining and sharing with all of us today. I'm going to start by asking, why do you support St. Damien?
Well, hello, Jennifer. Thank you for inviting us to be a part of today's Lunch and Learn program, and especially on today, which is World Health Day. And today is the day where we should reflect upon healthcare needs of our brothers and sisters around the globe. So you asked me why Ellen and I have committed ourselves in support of St. Damien Hospital. Well, that's a pretty simple answer. We believe that healthcare is a basic human right for every child in the world. That every child should have adequate health care, they should have access to clean drinking water, they should have adequate nutrition, they should have access to schools, and they should live in an environment which is free of terror and violence. And we believe that the folks in Haiti share that same vision. Just because you are poor, you should not be denied these fundamental human rights that all children deserve around the world. When we first began working at St. Damien, we witnessed compassionate care that was given by physicians and nurses and staff alike from the top to the bottom. And to be quite frank, we believe that was a result of the leadership of St. Damien. When we first arrived, Dr. Genevieve Vardy was the medical director at that time, and she ensured that everyone received the best care possible from the staff who was there. And she led in a way that was remarkable. Shortly after the earthquake, when times are very, very stressful. After Dr. Artie, the hospital was led by Dr. Jacqueline Gaudier, who did an outstanding job for a number of years. And now it's been, the leadership torch has been passed to Dr. Pascal Gassant, who we're excited about where that will take us. This is a unique time of the year. We were in the middle of Holy Week, the most important week for Christians around the world. Not only that, but our Muslim brothers and sisters are in the middle of Ramadan, and tonight, our Jewish friends will come together to celebrate Passover. Our spiritual leader in Haiti, we cannot say enough about. Father Rick Frechette was and is the spiritual leader of the institution. He has been an inspiration for all of us who have been there. We admire the work that he continues to do on a daily basis. It's really remarkable, and we pray for him every day.
Indeed, Jeff. Can you share how St. Damien is similar in services and healthcare provisions to what you experienced as a pediatric physician here in the U.S.?
Sure. St. Damien is a full service hospital. They provide both acute, chronic care and both inpatient and outpatient settings. Like here, medical folks are committed to providing the best care they can for their patients and putting their patients and their family needs above everything else in the hospital. The remarkable thing about St. Damien that even in very, very difficult times, there's been an earthquake, there has been hurricanes, there has now been incredible civil unrest. But in spite of all those things, the hospital continues to function 24 hours a day, 7 days a week. I don't know if that would happen in any other place in the world, but we should be proud of what they have done in their institution.
Absolutely. When you think about St. Damien compared to your own experience here, what is different?
Well, so it is difficult. It is hard to be a physician at St. Damien. They lack many of the things that we take for granted. We have therapeutic tools and diagnostic tools in the United States that we couldn't think about not having to take care of patients. We wouldn't even think about going to work. And now it's even become more difficult because of the civil unrest and gangs and blockades. Many of the basic medical supplies are difficult to get. The supply chains have been cut off, and it is even more difficult today than it was when we first started going there. There is also disparity of funding, and that's a huge issue. In the United States, we work in a system where we are funded through private and public insurance, which doesn't exist in the country of Haiti. It's just not there. They can only exist with funding from outside of their country. That said, the staff are committed to the work. They're resourceful, and they make ends meet in ways that they provide life-saving care with what they have.
For sure. Something I would truly hate to think about, but from your perspective, what if there were no St. Damien in Haiti?
To be quite blunt, children would die. I mean, that is the reality of the situation there. The hospital provides services that aren't available throughout the country, either in limited or non-existent. They have oncology services there. They have cardiology services there. They have intensive care unit, which otherwise children can't thrive, can't live. They won't have a fighting chance. They really won't have a shot at life. We can't continue those services.
Thanks so much, Jeff. We now have the rare privilege of touring the hospital. Here's part one of our tour today, led by Fadul Amazil.
Welcome to St Damien Hospital. St Damien Hospital is a mother and child hospital here on the head of Taba and near of the U.S. Embassy. It's a pleasure for me to introduce you to the work we are doing here. We have several services at the hospital. For instance, we have the outpatient clinic. Outpatient clinic is the gate where all the children get in, and the nurse do the screening according to their needs. They will know exactly where to send them. We have the emergency room. At the emergency room, where we have the capacity for 20 cradles and 2 other opportunities. But when all the beds are full, there's no more children we can accept that. So for the extra one coming, we will stabilize the child and we will refer the child to another private doctors. The healthcare is really expensive in Haiti, So many times the parents prefer to stay here longer with the babies on their legs, waiting when there's a bed available. We are the intensive care unit where children who are in a bad situation, who need really care on a basis 24 hours, they are here. And beside the children who in needs, we have also children who have meningitis and children who have a major surgery and they need a follow-up.
Fadul, when we see the tragic images of Haiti in the media, it contrasts with the serenity, professionalism, and family images we see in this video. What have been the challenges in operating the hospital amid probably what is one of the worst times in history?
Thanks, Jennifer, for your question. And I think St Damien Hospital is almost the only hospital in Haiti that remains functional and operational despite all the problems. St Damien is the light that parents can see at the end of the tunnel when they are in the dark because of their illness children or pregnancy complication. The serenity, the professionalism of the staff is a response of the solidarity, hope, and love to those who come to St. Damien. We cannot remove their vulnerability, but we can improve their quality of life.
Thank you so much for sharing this perspective, Fadul. And next, through film, you'll take us back to St. Damien to share more about this special and essential place.
Okay, the maternity Rita Merli. The maternity Rita Merli is a high-risk maternity for pregnancies, ladies with complications. That means during their pregnancy, they might have a complication like high blood pressure, diabetic, and infection. We try to give them the best we can to help them. Now we are the oncology. Come and see. And this is the waiting area where we have for the outpatient clinic for the children who have cancer. We have our psychologists, our nurses, and all the children, they are here with their parents. This is the hospitalization ward where we hospitalize the children who need to be hospitalized. And we have our residents. We are preparing the next generation of pediatricians. So after some years, we will have new pediatricians.
Grâce aux bailleurs et aux généreux donateurs, nous pouvons renforcer notre capacité dans la prise en charge des enfants avec infection ou maladies catastrophiques et ainsi que la prise en charge des femmes enceintes à haut risque. Nous vous disons un grand merci.
It is now my privilege to introduce Dr. Ellen Kemp, who has been to Haiti many times over the years. Ellen, thank you so much for joining us. You have so many stories given the longtime support of the hospital. Is there one story that you might share with us today?
Well, first off, thanks for coordinating and inviting us to this forum. Jeff and I are really very honored to be part of this. So I've been asked to think about experiences or something that I could share. And as I've then looked back at the many experiences Jeff and I have had during our gigs in international health, I've been able to reflect and look at so many great experiences that we've got to be involved in. But it became very obvious that they all come down to the same thread. The same theme in all of these experiences is that the world is just so little if we would just let it be. We just need to learn to make it littler. Moms all over the world just want to be good moms, and dads just want to be good dads and provide. That's what parents want for their children. But depending on where you're born, if we have the good fortune of being born in the United States, we have so much, or in other developed countries. We have so much. We have access to good, great healthcare. And we think it's kind of normal. But if you're born in a country like Haiti, you are just have so little. You have little to no access to even basic healthcare, no access to even clean water, to food, to shelter, or unfortunately, even to safety. Because of our involvement in St. Damien's over the years, Jeff and I have been blessed to be involved in a program to bring Haitian children and infants back to our home hospital in Akron, Ohio, Akron Children's Hospital, to receive life-saving surgeries. These kids would die without heart surgeries. And then, God willing, we get to return them back to Haiti, back to their Haitian families after healing. And I bet you can imagine the trips of returning back. I can't explain it. Because many times parents had to sign guardianship off to us or to me, so that their kids would just have a shot at life. And I just continue to be in awe of the strength and the trust that a parent must just garner from within to know that they are placing their child in a stranger's arms because they know it's their child's only hope for life. I mean, just think about it, just to pass off your child and pass off custody because that's your only hope. And that's reality in Haiti. I vividly remember a sobbing Haitian mother, Rootson's mother, placing her infant in my arms and asking me during the sobs through an interpreter, but what will I do with my arms while he's gone and with you? And you might think like, what would you say? How would you deal with that? And I know I said something like, I'll love him as much as I can. I'll give him everything that I can. I'll give him the best care I can, but I can't be you. And I'm not going to be his mom. But wait with your arms ready, because God willing, I'll be back with him and place him back in your arms. And that's the reality in Haiti. I'm still in that awe of that mother and mothers and fathers' positions. To live in a country where putting your infant into a stranger's arms is your only hope. It's still like, every time I think about it, I think like, how could this be? So I think that's why we're passionate about giving back to Haiti and to St. Damien's. We're trying to make the world a little smaller, and I think that's what we're all doing here today. And we're trying to give mom and dads an opportunity to parent healthier children.
Wow, you know, as a parent myself, Ellen, that's such a powerful story. And I've personally had the privilege of being on the ground, standing in front of St. Damien while you brought a child back to her mother. And it's one of my most treasured photos from one of our trips together. Just such a special, powerful moment. Captured that in a picture. There were no dry eyes.
Right. And picture that. I mean, there isn't. I mean, the sobs are full of hugs with, you know, as a mother and as this mother just saying, I'll do my best, you know, but to be in that mom's position is just amazing. You know?
Absolutely. It takes a lot of courage to give your child to a stranger and hope you're bringing them back whole.
Yeah.
So
Yeah.
thank you so much for all of that work that you've done, for sure. And from your perspective, how can anyone interested in tending to the healthcare needs of our global brothers and sisters help?
I think, you know, many people think, well, how can you help? I think it used to be years ago, one quick answer was just, you know, go to Haiti and work, go direct patient care, go down there and help. And that's very exciting and stimulating and fulfilling and adventurous. And Jeff and I have done it a lot. You know, working together shoulder to shoulder with our Haitian colleagues and really hands-on caring for Haitian children and infants. But obviously that's not realistic or doable or at times impossible, certainly right now. So education is another important avenue. I think it's already been mentioned about the United States Pediatric Hospital Consortium. Many pediatricians, professionals in the pediatric hospital groups have taught in Haiti, done in-services, done lectures, done classes. And we're thankful now that the internet has made the world smaller. We have Zoom conferences, telemedicine, WhatsApp. There is ongoing communication. There's a very vibrant pediatric residency program at St. Damien's, I think because of all the work with the Pediatric Hospital Consortium. And pre-COVID, residents would come up to the States at host hospitals and do in-services to learn about our patient models, our protocols. And we also learned from them. We learned that Haiti can do so much with so little. And education is often very bi-directional. We mentioned before the materials and supplies. They are just so lacking in Haiti. And as things get worse in Haiti, materials and supplies get more scarce. Not just high-tech items, but basic healthcare need items. We wouldn't know how to function without stuff. They do. So then it gets down to, well, how do you do direct patient care, education, materials and supplies? What's it take? How do you do that? And the fact of the matter is, it's not realized without financial support. It just can't be. You know, that's what drives this whole ship. And now more than ever, for the continued viability of St. Damien's and the Haitian families, we need financial support.
Thank you so much, Ellen. Before taking questions in the Q&A, which I kindly remind you to put any questions that you may have for us there, I do have one more question. It is for Dr. Pascal Gassant.
Yes, I'm here, Jennifer. Hi, everybody.
Thank you. Dr. Gasson, we just heard Ellen speak about the vital need of material items and donations to keep St. Damien running. I'll be honest with you that some donors are reluctant to give because they think the situation in Haiti is hopeless. What do you say to them?
So thank you for giving us the opportunity to expose our terrible everyday challenges to this wonderful audience. And despite these difficulties, we continue to be operational, but I really understand this concern. But I said that we are on the front line. That means that we are situated in a red zone. So our doctors and staff risk their lives each and every day to serve the sick and provide an emergency care to all the populations, and especially to the most vulnerable who really need us. If we can still have hope, then we need all of you also to have hope. So we need your help, the help of everyone of this wonderful audience. Thank you.
Thank you, Pascal. We are praying for all of you. Okay, we're going to start taking questions from our Q&A box for any of our speakers today. One of our first questions is, how are services paid for at the hospital? How much does it cost for services at St. Damien? If you, Pascal, or Fadul might respond to that.
Okay, thank you for this answer. At St. Damien, we see health before money. That means that if a person do not have money to pay our services, it will still receive the care. But from the patient, we are not asking to pay the money, but to give a cotization that we consider as a participation to the care that they receive. But as I said before, we prioritize health before money. So if the person does not have money, it will not be a problem to receive the care that we can offer to the sick children or these women that have to give birth.
You know, following up on that, Pascal, you know, we know the crisis in Haiti has escalated over the last 6 months, especially, and with St. Damien now in a red zone. Can you perhaps tell us how the hospital has had to adapt in light of this environment?
Okay, thank you, Jennifer, for this question. We have to improve our security. So we have add more security in our gate with stronger protocols to allow people that we can be able to enter to the hospital. We have also installed security camera in the hospital. We control the visit. After a certain hour, we expect that only emergency can enter at the hospital. So we have to take some measure that can increase the security of the patient and also for the employees.
Yes, definitely. Other questions perhaps for anyone on our panel that anyone in our audience might like to put forward? Please do so in the Q&A. How many doctors and staff are there currently at St. Damien? Where do they come from? Are they all Haitian?
Yes, our staff is everybody is Haitian. Where they come from all the parts of the capital of Port-au-Prince, and how many doctors and staff are there. I cannot answer exactly these questions because we have it is it is a dynamic movement, and we have lost a lot of our staff, medical staff, nursing staff with the humanitarian program. So now I cannot give exactly number, but we are about 20 or 25 doctors, because we lost like half of our medical staff, and also we are losing a lot of nurses and other type of employees.
Yes. It's understandable under all of the circumstances, right? We can't blame anyone for sure. And we're so grateful for everyone who is so committed and staying on and staying hopeful. Certainly your hope transcends to us. Another question, that we have is there still a dental clinic at the hospital? We have an audience member who's had the privilege of working with Ron and Ronnie Cruz in the dental clinic some years ago, and the curiosity is if the dental clinic is still there and running.
Yes, the clinical dental clinic is still running Monday through Friday, and we still receiving people from 7 to 3 o'clock in the afternoon. So we still have the dental clinic.
Great. I do want to make a plug, since we just came through the month of March and we honored International Women and all of our strong women at St. Damien. While we're not talking directly about the number of staff, I do want to share that 80% of our staff at St. Damien are female. And that's really admirable for sure. Any other questions that we might have? In the spirit of time, we certainly want to respect your time today. Okay, well, I think it's time to come to a close. Unfortunately, we can't be in Haiti, but we do hope that you enjoyed visiting with us virtually today. If we didn't get to answer any questions, or might you have other questions that come up, please feel free to reach out to me directly. Most of you, I think, know how to get in touch with me for sure, and I'd be happy to follow up and chat with you. A very big thank you to Jeff and Ellen and Pascal and Fadul for your time and your perspectives today, and certainly thank you to all of you who attended. We're grateful to have you.
Merci. Thank you.
Thanks, everyone. We'll connect again soon. Have a good rest of your day.